For 93 days now, Kenyans have been without medical care in public health facilities and have been treated to court sessions and mediation attempts between the KMPDU and the national and county governments, which have almost brokered a deal but flopped at the last minute. The contested collective bargaining agreement signed in 2013, which the government has failed to recognize, having undergone modifications. As at this morning, when the religious leaders were going to court, the warring parties were just waiting to put pen to paper on an amended CBA, recognition agreements and a return to work formula.
Doctors will not go back to work until that CBA that has been revised based on the 2013 CBA is signed and registered.
Under the amended CBA that was under discussion at the mediation talks led by the KNCHR and the LSK, the effective date of the new document would be 1st July 2013. This amended CBA would have a 7-member implementing committee, drawing 3 from the government and 4 members of the KMPDU. Doctors have expressed frustration that many of them serve even up to 10 years in one job grade and without earning a promotion. Under the new agreement, the government would be expected to promote doctors as per scheme of service in a timely fashion, and the entry level of the lowest ranking officer, who is an intern, would be C3, and it would be expected that these interns are posted within 30 days of completion of their internship. The national government would be required to come up with a fund to pay for postgraduate training of the doctors.
The Interreligious Council.
According to the report by the religious leaders handed to the Court of Appeal this morning, the government will have to dig deep into its pockets and pay out 13.9 billion shillings per year. Under the agreement, doctors would get 50% increment in salaries. Risk allowances would be backdated to July 2016 and have government spend 600 million shillings on doctors. They would also earn between 66,000 and 80,000 shillings in call allowances.
KMPDU has been doing this in good faith, and we have demonstrated that we have done this in good faith. Now the county governments are showing us that they are not doing it in good faith, and we ask them to come to the table. Let's finish this.
All that has been withdrawn by the government.
The session can go to the governors.
In the Court of Appeal, there was a disagreement on how the 3 documents, the CBA, the return to work formula and the recognition agreement, would be signed and in which order they would be implemented. According to the document in our possession, the union needed the signature of the county executive boards to enable them to be fully recognized as representatives of the doctors, and among many other issues, both the parties shall, upon execution of the agreement in accordance with provisions of the Labour Relations Act 2007, conclude a CBA within 90 days. The 93-day battle has been a long and winding journey for the KMPDU and the national and county governments, and as doctors say they have done their part, they want county governments to come faster and ensure that they sign the recognition agreements that will bring back these doctors to work. Leila Mohammed, NTV, Nairobi.